Catch the latest news on our website tribune.net.ph and follow us on Facebook, Twitter, and Instagram. You can also subscribe to our YouTube channel, Tribune Now. The Daily Tribune is one with the nation in facing the COVID-19 crisis, and in line with this, the Daily Tribune digital edition and press reader is now available for free online. You can also download the Daily Tribune app on Apple Store for iOS users and Google Play for Android users to get the latest and most comprehensive news online. Daily Tribune is also inviting everyone to join its community Viber KaTribu to get updates on the freshest and hottest news and entertainment stories of the day. Tarcito emoticons are also available on our community Viber. Just click on the link in this video to join.
Magandang hapon po mga katribu, and welcome to Kalingang KaTribu, because we care about your health and we care about staying strong together. With us is our special guest, Dr. Ricardo Boncan, Head of Dentistry of St. Luke's, Quezon City. Hi, Doc.
Hi, Cory. Thank you for having me over.
Doc, maybe people are wondering,
Yes.
ano ba ang kahalagahan ng pag-aalaga ng ating ngipin sa ating digestion at ating kalusugan? So, what is the connection between our oral hygiene, our teeth, our digestion, and our health?
Well, the first part of digestion, unang parte ng digestion, nangyayari sa ating bibig. No? Pag ninunguya natin pagkain kasama ng ating saliva, the food is not quite partially digested, pero it's broken down into pieces so that when you swallow it, your stomach can process it faster and more efficiently. So, kung ang oral health mo ay poor, if you have teeth that are not properly maintained or are painful, naturally, yung pagngunguya mo ng pagkain, hirap din. So you swallow bigger chunks of food. And in some cases, especially for some elderly people, they swallow big chunks of food. Sometimes they complain of stomach aches or they get gastritis because of those reasons.
Mm-hmm. So good health actually begins with good digestion.
That's right.
And digestion begins in our mouth.
Correct.
And
that's right. Yeah.
If you don't chew your food, what happens? You will have stomach upset. You'll have indigestion.
Stomach upset, yes.
And you will be stressing your stomach.
Correct.
Someone said, or there's a theory, that the human being was not created to eat meat because of the teeth that we have.
Okay.
How true is that, Doc?
It's not true because we were not created probably to eat raw food, because our teeth were not made to eat raw food because raw food is tough. But our ancestors, even our prehistoric ancestors, ate a lot of meat and fat actually, in order to sustain the energy levels they needed for hunting and when it became cold. So I guess that's not true. I think we are genetically evolved to eat meat, but of course, because our environment has changed, we now have houses, we now have may bahay na tayo, yung pagkain natin is cooked, luto na. We've naka-discover tayo ng certain types of foods to replace meat, which might be even more nutritious or healthier. Then I guess some people are thinking that way. No? But I don't believe it's entirely true that we were not made to eat meat. I love meat, so I have to stand by that.
Which particular part of our teeth or which set of teeth are used for breaking down meat?
Well, the front really is used for cutting through the meat, no, or the food. So whether it's meat or vegetables, apples and stuff like that. Pero pag na-cut na yan, it's the molars, the ones at the back, that are used for chewing it. Yeah. So you can imagine if you don't have molars for one reason or another,
right? Then
you don't get to break down the food chunks.
Mm-hmm.
So wala kang choice, but you swallow it, and your stomach will definitely digest it no matter what. But you get fuller easily. Sometimes the stomach malfunctions a little bit because it's too much. So that's where the problem happens.
Okay. As a dentist,
yes,
and I'm sure you've seen and looked into the mouths of so many patients. What is the one common problem of your patients or Filipinos in general?
Okay. When I started almost 30 years ago, the most common problem would be, because I saw patients in the younger generation back then.
Mm-hmm.
The more common problems would be tooth decay. That would be the more common problem. So as we progressed in practice, the younger generation now has very little tooth decay because possibly they're more conscious, the dental products are better. Now I see middle-aged and the elderly, the parents of my patients who have grown up, and still I see the effects of early loss of teeth in these patients.
Mm-hmm.
So not just tooth decay, but also what we call gingival problems, like periodontal problems. Yes.
Right.
So the supporting structures of the teeth are compromised. So it's a very wide variation across ages in these 30 years of practice that I've had. Yeah.
Well, how do you maintain your gum health? Especially for the benefit of all our KaTribu watching us right now.
Oh, very, very simple, no? The maintenance of your teeth starts when you're young. It's got to be a behavior.
Yes.
It's got to be a trained behavior. So you brush at least twice a day, morning when you wake up, evening before going to bed. You don't snack. Huwag ka nang kumain pagtapos mag-brush sa gabi. But you also have the additional thing of flossing at night. And flossing starts at somewhere the age of maybe mid-teens, early to mid-teens, when the permanent teeth are tighter together, and food can get packed in. So the maintenance of gums, like your gingiva, your gums, it starts with brushing and flossing daily, that habit, and probably avoiding certain types of sugary foods or processed carbohydrates. Because when you have decay, that's a parang pugad ng bacteria yan eh. It's a nest for bacteria. It also affects the gums. You see?
Would it be okay? Go ahead, Doc. Go ahead.
So when you have decay, you most of the time we also see gum problems beside the area where there's decay, where there are decay teeth.
Is there such a thing as brushing too hard?
Yes. Your gums are not made of rubber. Okay, so they're mucosa. We call them mucosa, epithelialized mucosa. So just they're slightly softer than skin, and their turnover rate, the cell turnover rate, is like skin. So you cannot brush it with a very hard brush, or you cannot put pressure on it too much. Otherwise, you're going to damage the gingiva. So what I always advise patients is, if you're going to brush, let the brush do the work, not your pressure. And if the brush isn't doing the work, you take a look at your toothbrush, baka naman yung bristles mo, nakadapa na lahat. That's why time to change. Kaya you have to put too much pressure.
Okay, the consumers get confused when you go to the grocery and you see so many different kinds of toothbrushes.
Yes.
Should it be hard? Should it be soft bristle? Should it be short? Should it be jagged? What really is the ideal toothbrush?
Well, I always advise soft. Don't get the ultra soft, because tactile, if it's ultra soft, you tend to put more pressure. If it's too hard, you can damage the gums. I always say soft. With regard to the design that's proprietary, I have absolutely no idea what one's advantage is over the other.
Right, but for as long as you have a toothbrush, that's good enough.
Yes.
Okay,
Yes.
and the last question before we go on break
Yes.
is, if you don't have toothpaste, can you use sea salt?
That's going to be rough on your gingiva, your gums. You can injure your gums with that. So I think the toothpaste now is so affordable,
Yes.
even in sachets. So I would really make it a point to buy toothpaste to preserve the gums and the teeth.
What about baking soda?
It's also an abrasive.
So not recommended.
You don't use it regularly. I recommend a sprinkling of that once a week, probably, if you're a heavy coffee drinker or heavy wine drinker, to help remove stains.
So that's a nice tip, Doc.
Mm-hmm. Yep.
For the heavy wine and
Coffee drinker or tea
coffee
drinker.
drinkers.
Yes.
You can stain your teeth, right?
Mm-hmm. Yes.
Just put a sprinkle of baking soda.
On your toothpaste, but just do that maybe once a week.
Ayan, meron
Yeah.
na tayong tip, mga katribo. Babalik po kami, wag po kayong aalis.
Good morning, sir. How may I help you?
Bakit kailangan ko pang pumunta sa bangko?
Oo nga naman, sir. Ba't kailangan pong pumunta sa bangko?
Why not get a UB app so you can do all these without going to the bank? Bank the way you live. Union Bank.
We're back, mga katribo, and our guest is Dr. Ricardo Boncan, head of the Department of Dentistry of St. Luke's, Quezon City. And we're talking about gum health and the health of your mouth in general. Doc, we were talking about what the different ways that we can take care of our teeth. So you're saying then that just any kind of toothbrush is fine for as long as it's a soft bristle, correct?
Yes.
Right. And that we should do flossing after every meal, or
No, you just do that once a day at night. And when you floss, don't do a sawing motion. It's just in and out in between your teeth.
Oh,
Because what some people do is you do a sawing motion and you can injure your gums that way.
I see.
The purpose of the floss is really to clean the in-betweens of food and plaque. Mm-mm.
So you do not, when you floss, you do not go this way?
You just go in one side of the tooth, in the other side of the tooth, and out. You don't pull it. Yeah, you don't pull it from. Don't pull it back and forth.
Okay.
Yes.
All right. Now, you were saying then that people who are seniors or elderly, you notice there's more, there's a greater risk of tooth decay problem in the elderly that you've seen in the last few years.
Well, actually, I would imagine that the elderly are the ones who had lesser dental care when they were younger. So I see not decay, but maybe tooth loss, broken down restorations, meaning you have fillings or crowns that have broken down. And in the hospital, this is a bit of a problem because when the elderly are medically compromised, when they have medical conditions that need nutrition, they sometimes send them to us. And sometimes because of the medical condition, we're limited with what we can do for them. So I always tell our patients now, these days, you better take care of your teeth. And unfortunately, many Filipinos kasi, they look at the teeth as parang an accessory for only for smiling or what. They don't really give it primary importance. So maybe it's somewhere down the line, maybe just slightly above your hair, getting your hair fixed or something like that. And kasi they always think na mahal, pero mahal lang talaga maggawa ng ngipin pag hindi mo inalagaan. But the yearly, twice a year, 3 times a year visits for hygiene, no, preventive, is not actually expensive to do. Yeah.
What about dental implants? How important are they?
Well, they're for me, no, currently, they're now the next best thing to replacing lost teeth. It's what we call the standard of care in replacing single or sometimes multiple teeth. The thing you have to remember with implants is you got to go to someone. Kailan pumunta ka sa marunong gumawa, no? There is a procedure of planning this, of doing the images and doing the actual work so that the implant becomes successful. That your chances of success are very high. So, ang dami kasing dentists who do implants after attending a 3-day seminar. I don't advise that.
That's tricky.
That's tricky. Yeah, that's tricky.
Yes. So you're saying then that a dental implant is forever.
You have to take care of it like a regular tooth, believe it or not. It is subject to the same infection and problems of a regular tooth. So once you get an implant, you have to take care of it with proper brushing and flossing. And you have to go to your dentist to have it cleaned properly, the same way you do your regular teeth.
Right. Yeah. Exactly. Doc, in your opinion, what are the best supplements one can take? Or in terms of nutrition, whether you get it from natural food sources or supplements, health supplements. What would be the vitamins and minerals to maintain good dental hygiene and health?
Well, for me, it's the diet really that's number one. No, like for example, the Philippine Dental Association these past few years have been advocating, the removal or reduction of sugar in drinks. So in their conferences and conventions, they only serve water, bottled water. They don't allow juices to be served. So for me, diet is number one. Sugar, processed carbohydrates that really will destroy your teeth. Number two is smoking. Cigarette smoking destroys the gum and increases decay rate tremendously. So for me, I discourage my patients who smoke from smoking because I've seen the effects. But with regard to supplements, once your teeth and bones are formed, there are no added supplements that you can take that can reinforce and strengthen it. So whatever fluoride they add to toothpaste, for example, will help. But taking your supplements has more to do with general well-being rather than dental or oral health. But of course, you have certain vitamins that help the integrity of the gums, no? The health of the gums. Vitamin C, of course, you don't want to be deficient in that. Vitamin B, you don't want to be deficient in that. And of course, for bone health is vitamin D and the sun, of course. Other than that, if you have a diet that's varied or has good variety, balanced, I think you should do fine. And good hygiene, of course.
Mm-hmm. In the middle of all this pandemic, people are being advised. You get all sorts of advice from everyone. Yes. And it's gone viral. You have to have a mouthwash of sea salt and warm water as often as you can. How true is that in terms of protecting your mouth from any invasion of the coronavirus? Okay.
Well, first of all, the coronavirus is actually the portal of entry really is the nose because it's breathed in, no? Because we don't go around with our mouths open anyway when we're breathing. Of course, now we have a mask. But prior to the mask, we don't go around with our mouths open. So the primary portal of entry talaga sa ilong. At sa mata. Ngayon, alam nila sa mata pwede rin. No? So, yung gargling with sea salt, that only that helps with your regular hygiene. But with regards to protecting you from the virus, I don't think it will do much, even if you do that frequently in a day. The best protection really from the virus is to wear a mask and protective eyewear.
Mm-hmm.
Yeah, so gargling with sea salt, I wouldn't do it as often too, because it can also cause dryness, unnecessary dryness of the mouth. And if you want to use it, just use a pinch of salt in a little water. You don't have to use a teaspoon of salt, especially if meron kang alta presyon or hypertension.
Oops, I put 1 teaspoon.
No need, Cory, no need. Yeah.
Okay, all right. So, Doc, I think we have time for our netizens corner. We move on to our netizens corner after this break. Huwag po kayong aalis.
Ang Philippine Offshore Gaming Operators o POGO ay isang legitimate business entity na nagbibigay serbisyo sa offshore gaming para lamang sa mga manlalarong nasa abroad sa pamamagitan ng internet. Ang mga serbisyong handog nito ay katulad ng casino games at sports betting na pwedeng laruin kahit wala sa casino. Sa Pilipinas, walang POGO operators. Tanging POGO service providers lamang dahil nagaganap ang mga laro sa labas ng bansa.
Araneta City, home to the country's first indoor shopping mall, the world's original Thrilla, and the first ever Bini Bini pageant. Now a place for your first win, your first catch, your first home, your first big break, your first date, and even your first love. Araneta City, the city of firsts.
Ayan, mga katribu, we're ready for our Netizens Corner and we're going to accommodate your questions. Ang unang nagtanong ay si Bon ng Marikina. Please advise, pangingilo ng mga ngipin, mga sanhi at paggamot, sensitive teeth, causes and treatment, ano po ang mga pwedeng advice nyo sa akin?
Ang pangingilo ng ngipin, madaming sanhi. No? Pwedeng masyado kang malakas kumain ng masyado maasim, mga acidic foods or sugary foods that can cause hypersensitivity. But also, the most common cause ng hypersensitivity is decay, so or plaque buildup around the gum. So you really have to see your dentist. As a remedy, there are sensitive remedy toothpastes available. I won't name brands, no, but there are sensitive relief toothpastes that are available in the market and they work. But my advice is you get yourself seen kasi madaming sanhi talaga ang tooth sensitivity.
Okay, there's another question. Amor ng Tondo, advisable po ba na magpa-check up ngayon, pananakit na dulot ng orthodontics at braces, orthodontics and braces pain? In Filipino, please.
Yes. Okay, ganito yan. Ang mga dental offices, kung sumusunod sila sa guidelines ng Philippine Dental Association, malamang pag sumunod sila, medyo safe ang dental clinic sa pagtitingin ng pasyente ngayon. So, kung talagang kailangan mo patingin, pumunta kayo sa dentista, I guess, na at least may tiwala kayo, no? Makikita niyo naman pagdating ninyo doon kung ano yung mga safety measures na ginagawa nila. Like naka-proper suit sila, meron silang sanitizer sa kanilang opisina, isa-sanitize ka rin nila, yung kanilang opisina malinis, wala masyadong nakakalat dyan. Most dental offices right now, at least that I know, if they have become compliant, since March nilabas namin yung guidelines, they will be safe to go to at this point. Most dental offices.
So it's safe to visit your dentist. Okay na
Yes.
okay, safe na safe.
Especially for procedures na hindi prolonged, no? Like masakit because of braces, if you need to clean a little bit, I think those are okay. Yeah.
Ay, masakit talaga yung braces. Noon, meron akong braces. Grabe. At the time, old-fashioned way, when they tighten it.
Yes, yes.
Ginaganon.
Yes.
Of nilyo. Oh, gosh. Tsaka stricta pa naman ang aking orthodontist. Ito, nanay na ako and I have a baby. Bakit mahalagang dalhin agad si baby sa dentista kapag lumabas na ang unang ngipin niya? Eunice of Kamuning, Quezon City.
Eunice, kasi kung anong mikrobyo ang nakadikit sa ngipin ng inyong baby, yun din ang mikrobyong didikit sa permanent teeth niya. So kailangan matanggal lahat yun at malinisan. Kung meron na silang decay sa baby teeth nila, yun din ang mag-aapekto sa kanilang permanent teeth.
Ayun. So talagang importante at mahalaga talaga dalhin si baby. Okay, Doc. Ayun. Doc, your last advice to our mga katribu.
My last advice is, una-una, of course, maintain your teeth while you're young because ayaw niyong mangyari yung nangyayari nakikita namin na pag may edad na, nahihirapan silang kumain, may medical problems, hindi makakain na maigi. But also, brush twice a day, floss in the evenings. Huwag na kayong kumain ng anything pagtapos ninyo mag-brush at floss sa gabi. And of course, avoid chips, crackers, because these have processed sugars and carbohydrates. Magtubig na lang kayo kung pwede. No? And can I just greet, because I promised some of my friends.
Of course, Doc.
Okay, I want to greet three sets of people. First, my Ateneo High School class of 93, especially Dr. Chody Alcantara, the very guapo and charming Dr. Chody Alcantara from Cebu. My UPC, the UP College of Dentistry class of 1990. And of course, the members of our department service, the St. Luke's Medical Center, Oral Surgery, Dentistry and Oral Surgery Service. So,
at si Dr. Nicky Montoya nag-hello sa inyo.
Dr. Nicky Montoya is my batchmate. So, he's part of that, yeah.
Doc, your contact number.
Yes. My clinic number is 7231071. Sorry, 87231071. That's the St. Luke's number. If you can't get in touch directly, you can call St. Luke's and they will connect you somehow to me. Yeah.
Okay. Thank you so much to our special guest today, Dr. Ricardo Boncan, Head of the Department of Dentistry of St. Luke's, Quezon City. Kaya kung meron po kayong mga problema sa mga ngipin, ayan, go to Dr. Boncan. So mga katribu, we'll see you again next week every Wednesday, 3 p.m. dito po sa Kalingang KaTribu. Stay safe, stay strong. We are in this together. God bless.
Catch the latest news on our website tribune.net.ph and follow us on Facebook, Twitter, and Instagram. You can also subscribe to our YouTube channel, Tribune Now. The Daily Tribune is one with the nation in facing the COVID-19 crisis, and in line with this, the Daily Tribune Digital Edition and Press Reader is now available for free online. You can also download the Daily Tribune app on Apple Store for iOS users and Google Play for Android users to get the latest and most comprehensive news online. Daily Tribune is also inviting everyone to join its community Viber KaTribu to get updates on the freshest and hottest news and entertainment stories of the day. Tarcito emoticons are also available on our community Viber. Just click on the link in this video to join.
Click, that's it. Never thought self-service can be this slick. Modify plans in a snap, walang hirap. It's a wrap, just tap the app. Now you can check, view, subscribe, renew. Help and support for you. Out with the ring apps are the in thing. You know what to do. Globe at home and Globe One, all in the Globe app na yan. Self-service and easy to use. Mas okay tayo dyan. Globe at home and Globe One, all in the Globe app na yan. Instant response, no hold time pa, wala nang hintayan. Download Globe at Home and Globe One app, all in the Globe app na yan. Download the Globe One and Globe at Home apps from Google Play Store and Apple App Store now. Download Globe at Home and Globe One app all in the Globe app na yan.
Bilang bagong mag-asawa, sabay kaming natututo sa buhay.
Sabay rin namin inaaral ng mga bayarin sa bahay.
Kahit kami, nagtaka sa biglang laki ng electricity bill namin. Huwag pong mangambang maputulan. Sinisigurado ng Meralco na walang disconnection hanggang September.
Estimated bills lang ang natanggap natin ng March, April at para sa ilan, May. Dahil sa lockdown, isang tabi to para hindi na maguluhan.
Ang May o June ay actual meter reading na. Kung May, nagka-actual reading, ibabawas dito ang huling reading bago mag-ECQ. Yan lang po ang ating babayaran hanggang 3 buwang konsumo.
Kung estimated reading sa May at June nagka-actual reading, ibabawas din dito ang huling reading bago mag-ECQ. Yan lang po ang ating babayaran. Hanggang 4 na buwang konsumo, walang labis. Tandaan, kung ano lang na konsumo,
yun lang ang babayaran.
ako po si Mateo G.
At ako naman po si Sarah G.
G?
G!